I am delighted to be joined today by my friend and colleague, Dr. Hokehe Eko. She is an integrative pediatrician, and we are going to be talking all about integrative strategies to manage ADHD. Whether you're an adult who's struggling with ADHD or you have kids who you think might have ADHD or who have a diagnosis, this conversation is going to be so valuable to you. I'm Dr. Nishi Bhopal. I'm an integrative psychiatrist and sleep medicine physician. All right, Dr. Eko, I'll turn it over to you. Can you tell us a little bit about yourself and what you do?
Yes, thank you. First of all, thank you so much for having me on your platform. I really appreciate the opportunity, and I'm so thrilled to have met you, and you're doing amazing work. So, yes, I'm an integrative pediatrician, and I run Glow Pediatrics, and I specialize just in taking care of children with ADHD and autism because I have a brain story myself. So, when I was when I was a junior in college, I was in two car accidents exactly 6 months apart. And I started not to do well in school. I had concussions and all of that. So I was sent to see a neuropsychologist who told me that, who asked me, what do you want to do? And I told him that I wanted to be a pediatrician since I was 5. And so he told me that you're only average. You are not going to go to medical school. You will actually never go to medical school. And I suggest you go find something else to do with your life. So to say that that shattered me was an understatement because here I was 17 years old, like all these dreams. So of course I proceeded to fail out of school because I really believed what he said, that I couldn't do it. So I went from the A student to the F student, and my parents were like, okay. And it was a big struggle because I was also depressed. I was just like, didn't know what to do with myself. But my parents were like, no, you're going back to school. It doesn't matter what he said. Who is he, anyways? And so they were like, yes, you're absolutely going back to school. So I always pause in my story to point out that you just need one person in your corner that's going to encourage you. So for adults, your children just need one parent that's going to say, yes, you can do it. And any child can accomplish what their dreams are. And so my parents said I had to go back to school. So I went back to school. Did I struggle? Yes, but I went back to school and here I am. So if I had listened and completely believed and didn't listen to my parents, I wouldn't be sitting here. But that's the power of of your brain, that your brain, you're not stuck with the brain you have, that your brain can heal and then you can go on to do the things that you have desired to do. So
Wow, thank you for sharing that. That's such a powerful story. And like you just said, it's an illustration that the brain can heal and change, and we're not destined to live with, symptoms or challenges that might feel like they're permanent or just, unchangeable.
yeah.
And I love what you said about you just need one person in your corner. That is so true.
Yes.
Um, so maybe we can talk a little bit more about the work that you do now with medicine and pediatrics and ADHD and autism. Maybe starting with what even is integrative medicine? I know a lot of people have maybe heard of it or not heard of it, and they're like, what even is that? So can you share more about what integrative medicine is?
Yes, absolutely. Yes, it is a confusing word. It's a big, long, confusing word. And sometimes I hear myself saying, okay, holistic, but that doesn't quite capture it. So basically, what integrative medicine is that it's a combination of conventional medicine, which is the usual doctor you go to, like how me and you went to medical school and we got trained in pediatrics and in psychiatry. That's conventional medicine. And then it's a combination of that plus evidence-based complementary medicine. So what does complementary medicine mean? It's the art of looking at the whole person. So we're not just looking at their symptoms. So for example, we're not just saying, oh, this child is aggressive, that's it. Or the child is hyperactive. Okay, so they have ADHD, and then yeah, that's the end of the story. So instead, we ask, as integrative medicine doctors, we ask, why is the child hyperactive? What is driving the hyperactivity? So we're looking at the root causes of the behavior that you see present in your child. So that's what integrative medicine is. So we combine, yes, we're not against medication necessarily, but that's not usually the first route. The first route is the questions. Why? Why is this child not sleeping? Why is your child picky? Why is your child not why is your child so hyperactive? Why is your child not focusing? We're asking questions and looking at what's driving the behaviors and addressing those behaviors. Most times not with medication, because there's a lot of things that you can address without the use of medication.
That's really helpful. And yeah, just that framing of looking at not just what are the symptoms, but why are the symptoms there, or what are the symptoms telling us, and what are the root causes that maybe haven't been addressed or that we need to look at. And I think the other key point, just to highlight that you said, is that it's conventional medicine plus evidence-based complementary and alternative strategies. So we don't just reject medication and blindly adopt these holistic modalities. It really is blending the best of both worlds.
Correct.
Maybe could you share some examples of like what are some integrative strategies that you might recommend to your patients?
Okay, great. So we'll talk about ADHD. So a big one with ADHD is most of the kids are constipated. I've noticed. And the same thing with autism. I could tell you almost 99% of them are constipated. So from an integrative standpoint, the question is why? So I'll tell you a story. I had a 4-year-old come into my office with mom, and mom was asking for an ADHD evaluation. And I said, well, I'm not going to do that because I also do autism and ADHD evaluation. So I said, he's 4. Let's talk about what else is going on with him, because I typically don't we typically will not diagnose ADHD until they are 6, so we can see what's going on both at home and at school. And so in the course of the conversation, turns out, yes, he's hyperactive, but he's also constipated. He doesn't sleep well at night. He drinks chocolate milk in the middle of the night. And I was like, okay, so that's already a cycle, because from all the research that we know, the evidence-based complementary medicine that we know is that the brain and the gut are connected, right? So the gut can be referred to as your second brain. And so whatever you put in your mouth, you literally the food you eat too. Whatever you put in your mouth is going to affect the way your brain functions. So knowing that, I said, okay, so here are the things. It's important that he sleeps, because any child that doesn't sleep will be hyperactive usually, because their brain needs the sleep to calm down, right? So let's work on his sleep. Let's take devices out of the room. Let's set up a sleep routine for him. But in addition, we need to work on the constipation, because the pain from the constipation could be keeping him awake, right? So what can I do for constipation that will also help with sleep? And so enter magnesium, right? So there's tons of studies, even the NIH, which can be considered conventional, has studied this, and it shows that more than 90% of children with ADHD are deficient in magnesium. They are deficient in some other things, but definitely magnesium. So, and what does magnesium do, right? Magnesium helps promote sleep. It helps nourish brain cells, and it will clean you out if you're constipated. So voila, I'm going to help this kid. So I put him on some magnesium. I told mom, stop giving him chocolate milk in the middle of the night, because the sugar is also contributing to the not sleeping, as well as dairy constipates. So we have 2 things that are affecting his sleep that will affect his behavior. So we took out the chocolate milk at night. We changed him over to some almond milk. We worked on his sleep. We started the magnesium. I saw him in 6 weeks. Hyperactivity is lessened. So what changed? The kid now sleeps all night and no longer drinks chocolate milk in the middle of the night. His pooping has improved, so that's better. So therefore, he's sleeping better and his behavior is better in the morning. So you see, if we had gone at it from the purely conventional lens, I could have sent him to a psychiatrist who could have diagnosed him very well with ADHD, but still we're going to continue all the other behaviors, which will not improve even when the medication wears off, right? Because it's only good for so many hours, and then we'll still have the behavior remaining. So from an integrative lens is, what can we do? So it's not just we are putting a Band-Aid on the behavior that still remains, and all the things aggravating the behavior remain. So how can we solve it and help the child overall? So.
It's so wonderful to hear that because it really is a personalized approach, right? So you're looking at the root cause, and it's not just like, oh, let's just go, throw a supplement at it, but okay, what is going on here? How can we, target the intervention based on this, this kid's symptoms or this patient's symptoms? And as you were talking, I was thinking about the patients that we see in our practice, which are adults. We don't work with kids, but it's so similar,
Mm-hmm.
optimizing gut health, helping people with, constipation and bowel movements. So many of our patients struggle with those kinds of symptoms, sleep, eliminating foods that might be causing issues, using supplements in a targeted way. So for
Yeah.
anyone listening, even if you don't have kids with ADHD, think about yourself and how you might be able to apply some of these principles.
Yes. Yes.
And
I
then,
often hear
yeah,
the parents give aha, like, I have the same thing. And I'm like, double the dose of magnesium and help yourself.
exactly, exactly. It's really universal. And
Yeah.
I was also thinking like, just about the stimulant shortage. There's a shortage of stimulant medications like Adderall, Vyvanse, these types of things. Our patients are really struggling to get these medication prescriptions filled. But there's all these other strategies, as you were just talking about, that people can employ to reduce their reliance on medication.
Absolutely. Yes. Yes, there is a place for medication, but like we've pointed out, or we're trying to point out, that there's other things that you can do when you address the child's gut health, what's going on in the environment, and all of those things do affect the behavior. So we're not saying there's no place for medicine, but appropriately. But in a case like where there's no medicine, then we really need to work on what's going on with the child and the family as a whole, because what affects the child affects the family. So
That's exactly right. And okay, so how might someone, if someone has a child, and they think, maybe my kid has ADHD, what are some signs to look out for? And then in addition to that, a lot of times the adults then are like, wait a minute, I think I might have it too. So what are some signs for the kids and then for the adults?
okay. So there's differences between boys and girls with ADHD symptoms. So that's important to point out, because most research has shown that mostly girls will not show up as hyperactive necessarily. They may be more avoidant, and that's the descriptions usually are, she's just daydreaming in class, she's not paying attention, she can't follow more than two directions at a time. And seems to say she forgets things easily, and you're like, why is a 6-year-old forgetting so easily, right? And and then with boys, more of the hyperactive. Doesn't mean girls cannot be. This is all with the caveat. Yes, you can see this across the board, but if you have a daughter that's not hyperactive but shows these signs, then that's what you want to look for. So with boys, you see more of the hyperactivity, can see aggressiveness, um, not following directions. Sometimes there's an element of conduct disorder, like defiance, things like that. You can see, and definitely across the board, not doing well in school, or sometimes they could be doing well in school, but then in the other areas, like it takes them twice as much to be able to understand something you're saying to them, or they say their memory again, like I mentioned before. So those are some of the things that you would look for in a child. Um, that should give you a clue to maybe this child has ADHD and we need to examine it further. I mean, but the other thing I should say is, like the description I gave for the girls, I could also be describing depression, right? I could also be describing anxiety, which is making somebody be hyperactive. So that's why you really need to get evaluated and not just label your child as this. We really need to ask all the questions. What's going on with the child? And the environment is extremely important as well, because I have had a child that we thought was hyperactive, or everybody thought was, but it was because of a bad case of black mold in their house, and the child presented as hyperactive. So I'm saying all that to say, yes, there are some signs you look for, but you want to go to somebody who's going to look at everything. So we're not putting a label on something that's not. And then for adults, same thing. You can't complete tasks. you find that you start something and you don't finish it. Well, which could be anybody, because I too have that happens to me sometimes. Difficulty keeping relationships, you're more at risk for. So there's lots of research that untreated ADHD in adults can show up as taking risky behaviors, increased drug use, increased alcohol use, things like that, because it's almost like you're trying to medicate yourself. And so if you're having, and then racing thoughts, difficulty with sleep, you can't seem to shut your mind down to sleep. So those are all symptoms that you want to take note of, both for adults and kids. I mean, the sleeping and the racing of the mind, that's for both adults and kids.
It's really helpful how you just broke that down, and also how you emphasize that an evaluation is really important, because ADHD symptoms do overlap with anxiety and depression, and vice versa. And the environment is so important. Like, we're all walking around with distraction machines in our pocket, right? You know, we have our cell phones.
Yes.
And right, so like we're constantly distracted, and it is hard to focus. Like, our society is set up in such a way that our attention is being pulled in all these directions. And so, you know, there's a line between, you know, sort of like a normal reaction to your environment and situation, and then having a condition like ADHD. And so that's why working with somebody like you is so important. And you take that integrative approach. So, I mean, I haven't heard a lot of doctors talk about like black mold, looking for mold and other things in the environment that might be impacting a person's ability to function and to focus. So that's amazing that you also look at all of those aspects.
Right. Yes.
Great. So, what other integrative tips might you want to share with anyone listening who's dealing with ADHD themselves, or who has kids with it?
So first thing I'll say is, remember, you're not stuck with the brain you have. Your symptoms can improve. It's a matter of looking at what exactly is going on with you. And this is big for the kids, because often I've heard kids say, well, it's my ADHD that made me do that. Um, I point that out because we don't want our children to grow up thinking that they are less capable of something because they have ADHD. Very well-known people have ADHD. Simone Biles, the other swimmer, what's his name? Michael Phelps. They all have ADHD, right? And so, but there's something that comes with having ADHD, is like you can be hyper focused on something, right? And you do really well at it. Hence the world-class gymnast and world-class swimmer. So it's to look at, as parents, to look at your children and point and identify what are the strengths that my child has, and boost those strengths. Because your children already feel like they're less than the other kids at school. They feel they recognize that they're struggling. They may not be able to do everything the way the other children do, but they do have strengths. Everybody has a strength. So the key for parents, I always want to leave them with, is look at what your child is great at and boost that. If it's getting them extra music lessons because they can hear something and play it, that's what you want to boost, right? And when they do something good, because oftentimes the issue is with children with ADHD, oh my goodness, they can't follow directions, or they didn't do this, and all of that. So, but when they do something good, point it out specifically. Don't just say good job. Say, I like the way you took care of your sister. I like the way you spoke so nicely to your friend. Point it out. They're more likely to want to continue to do that behavior that you noticed was good, because they need all the extra self-esteem boosting that we can give them. And same thing for you adults. Don't be so down on yourself. If you find that it's hard for you to complete your tasks, there are ADHD coaches, there's different things that you can do to help yourself. If it's like giving yourself, okay, so if, for example, if you identify how long can I sit and focus for? So say it's 20 minutes. So then do 20 minutes and give yourself a brain break, which just means give yourself 2 minutes to stand up, walk around, whatever it is you want to do, and then come back and focus for another 20 minutes. That helps you get through your task versus fighting through it and then you don't finish it and it's not to the best of your ability. So that's something for both parents and kids. That will help with homework battles, so you can decrease homework battles. And for you parents, it will help you complete your tasks as well.
Excellent.
Sorry,
No,
I think that was long, but okay.
no, that's so helpful, so helpful. And I
Yeah.
think, the key takeaways are that, these are things that can be worked on, they can be changed. You're not stuck with, these kinds of, challenges with regard to focus and hyperactivity and all of this stuff. And really looking at the whole body, whether it's gut health, nutrition, looking at the environment, all of these things play a role, and they're all things that can be addressed.
Yes, absolutely.
Can you tell us more about what you offer in your practice and how people can work with you?
Yes, thank you for that. So, like I mentioned, my practice is called Glow Pediatrics. It's the practice for children with ADHD and autism. So there's few ways to work with me. I offer one-on-one care for the child. I'm also starting a group program where you can come in and be with other parents of like mind and parents that are going through similar struggles, and we can walk through things as a group. And that it's important to have community so you don't feel like you're all alone, because you're definitely not all alone and there is support. And so those are the two ways. In addition, I do ADHD and autism evaluations for the states of Oklahoma, Maryland, and Georgia, because there's a long wait list, and I'm a firm proponent of we need to get diagnosis done early so we can get our children the help they need on time, like in an early fashion, so that we can optimize their development. Because if you wait too long, the child doesn't mean you can't turn things around, but it's easier to do it within the first 5 years of life. So we offer that service as well. So
Amazing. That's such an important service. And we'll put your link in the video description below. So for those of you who are listening, you can go ahead and check out Dr. Eko's website and all the amazing services that she has to offer. And she's just offering such a unique blend of services and expertise that is really needed in this day and age. So thank you for the work that you do. And thank you for joining me today.
my pleasure. Thank you for having me. And you're doing amazing work too. So people,
Oh,
go check her out too. She's amazing.
oh, thank you.